Joining us now is Dr. Pat Basu. He is the Chief Medical Officer of Doctor on Demand, which is the company that Jay and I have that you've heard us talk about. Now, Dr. Basu has served as a White House Fellow. Prior to that, he served as Course Director of Health, Policy, and Economics at Stanford University. You've been listening to everything. What do you think of Josefina's claims when it comes to all of this lung manipulation? I mean, is this even remotely possible?
It's not possible at all. It is.
Step up here, because I want to be sure that he can hear you clearly and concisely. You just take my chair here.
Sure.
Just take my chair so you can speak directly to Maurice, if you would. Maurice, this is Dr. Pat Basu.
Nice to meet you.
So, is it possible what she's telling him is true?
There is no way this story is possible. And I should maybe just clear something up, because there's this talk about the black market, which does exist. But even in that case, it is not just a box of old organs that's lying around. There is no sort of black market box where they just sit there. Whether it's legal or the black market, that transplant has to be done in this very small window, or the lung itself will perish.
Okay, so what is the chance that she could go to Veracruz, get this lung, bring it back up to some clinic, some doctor does the transfer, it doesn't take, so she takes it out, puts another one in, saves this one for 3 weeks in a cooler or something at the clinic where they keep spare body parts, apparently, for 3 weeks, and then sell it again to some, or swap it for a ranch or whatever. What's the chance of that happening 3 weeks later?
Yeah, Maurice, I have to tell you, the chance of that is zero. There is no single aspect of that story is possible, let alone the entire chain of events. It is just entirely not possible in any universe.
Do you believe what he's telling you?
Well, I don't believe it.
You don't believe which?
I don't believe what he's saying. It happens down in Mexico, and it's...
Yeah, you cannot revive the lung once it is dead. There is a window of 6 hours, and even in that window, by the time it's getting there, the lung is literally perishing. It cannot be revived. It cannot be reused in that capacity at all.
Well, I don't know how that happens then.
Well, it doesn't.
It doesn't.
Huh?
It doesn't.
It doesn't happen.
It does.
Yeah.
I do know that the lung was 3 months in a container.
Okay, and so you think because she said that the laws of physics, the laws of science, the laws of medicine are suspended because of what she said. It just becomes true for her, but not for anybody else.
Well, I know that the lung was for 3 months until it was transferred.
The lung was outside the body for 3 months, and then put back in.
It's in a container. They have some type of solution in Mexico. And they have, I know, doctor,
Yeah.
I know.
Yeah.
This doesn't even make you think maybe she's lied to you?
No.
Okay. All right, listen, that's very important for me to hear. That's very important for me to hear. It helps me, that informs me to help inform you.